Alors on danse, danse. Alors on
Their lives are a game. Their lives full of. Their lives are a game.
alors on danse.
Their lives are a game. Their lives full of. Their lives are a game.
Alors on danse.
Their lives full of.
Hi, it's Stephanie with Muñequita Spa. Today's video, we're going to go into more details on the different types of fajas and when to wear them and why to wear them. So normally there is a stage 1 and a stage 2 faja, and now this new pop-up of the stage 3 faja. What's the stage 3 faja and when do you wear them? So we're going to go more into detail. Any questions, if you guys want us to go into more detail for a different video, comment below. Please don't forget to subscribe. And okay, so first thing first, the faja that you will first go into will depend on your plastic surgeon and what their preference is. We are not saying to not listen to them. We are saying to be fully well-rounded and educated in, you know, what they do and what makes them different, so you can do what's in your best interest for your recovery and to help you so stage 1 faja is low compression. It's very similar, if not the same, to Spanx. This is usually what plastic surgeons recommend for the first days, and if you had a tummy tuck, maybe the first weeks. Now again, this is for individuals who just freshly out of surgery, and if you have a tummy tuck, you may even go into a medical binder instead of a stage 1. So again, if you're an individual who had a BBL, we normally recommend anywhere between 2 to 3 weeks in a stage 1, and this is to reduce the chances of excess compression on the fat as it settles. However, we do recommend a 360 with the ab board and the backboard to keep compression in the abdominal area while still having low compression on the BBL. So for the tummy tuck, you want to wait, it's going to be a little longer, anywhere between 4 to 6 weeks to go out of your stage 1. This procedure is very invasive. You don't want to irritate these areas, cause any splitting or stretching or infections. So please be patient with your body, whether it's a stage 1 or a medical binder. Wait until the very top layer of the skin is dry before you go into stage 2. So the stage 2 faja is very, very tight compression. It's very hard to put on at first, and that's why we have the other video. If you guys need to figure out how to get them on the right way, or you're struggling, please check out our channel and see more on that video. But again, stage 2, it's high compression. For BBLs, it's after 3 weeks, and tummy tucks, it's once the cut is clean and dry. Stage 2 faja should be worn for anywhere between the first 2 to 3 months. It really depends on how aggressive your plastic surgeon was and how much they removed. But it is extremely important to reduce inflammation, help your skin reattach, and get everything pushed out the lymph system to keep your faja on 23 hours, 7 days of the week. And when it comes to BBLs, it's a little different. When it comes to your stage 2 faja, the most important thing that is going to either make or break whether or not you want to have this thing on all the time is you got to make sure your hips, your thighs, and that whole area is comfortable. Don't get it so tight that you feel like it is discouraging you from keeping it on all the time. That means you may need to tailor the waist, but the main thing is the hips and the thighs. Most companies have a little size chart on their measurements and what's within a certain range. This is very helpful, but this shouldn't be just your only way of going about and figuring out if this is the right faja for you. You really want to find a place that will let you try it on, or that you know someone has. So we'll list a couple of companies that we find very, very good. Please remember that whatever areas you had lipo on, you need compression. Your arms, compression all the way to the elbow, your thighs compression all the way up to your knee, your tummy compression. If you get a faja that doesn't cover the breast, you may create a rolly here. If you get a faja that's thighs very high, you may create an indentation in the middle of your thighs. So be careful and be smart with your faja. Last but not least, stage 3 faja. This is something very new. These usually have rods in them, and when your body is really delicate and moldable, not everyone recommends this. I don't really recommend this myself because I just feel like you need to heal, and the rods are very painful and irritating. I wouldn't recommend this until you're at least 3 months out, and this is just for your best interest. So if you're gonna decide to purchase a stage 3 faja, I don't think it'll be in your best interest to wear this at night. When we are sleeping, we breathe slower, which means our oxygen rate drops. If you have something that is hard, like a metal and a rod, this may compromise your oxygen level and cause you to go below 90, which is dangerous. Okay, so since we're in the subject of which fajas and who to get it from, I need to let you guys know. These custom fajas, tailored in Colombia, Tributo, they take forever to get here. I don't know if it's because of COVID. I don't know what exactly is going on. But we're talking about like 3 to 6 weeks, and by the time they get to you, you've gone down on so much inflammation that you got to get it custom again. So be smart and do your research, find out really what's going to go on with that. And I hope you find our videos very informative and will help you during your recovery and to make the right decisions. I feel like I went into a lot of detail. I don't know if I missed anything. If I did, please comment below. Let us know if you want us to make any other videos or go over another detail. Once again, don't forget to subscribe, and we're here for everyone that's post-op. So good luck with everything.
Their lives are a game. Their lives are full of. Their lives are a game.